Welcome to the Medicine Box. I'm your host, Ekta Batra, and today we are talking about something that is becoming one of India's biggest health concerns, obesity. The numbers are hard to ignore. Nearly 1 in 4 Indian women and men are now overweight or obese. Even our youngest are affected. The number of overweight children under 5 has jumped from 2.1% to 3.4% in just a few years. And here's what really stands out. We're gaining weight together as a family. Today, all adults are either overweight or obese in 1 in every 5th Indian home. A Lancet study now predicts that by 2050, 45 crore Indians, that's over a third of us, could be overweight or obese. And we may have one of the highest numbers of obese children in the world. This isn't just about how we look. Obesity is now being seen as a chronic disease. It often comes with a yo-yo pattern of weight gain and loss. And it plays a huge role in serious conditions like diabetes, heart disease, high blood pressure, cancer, and even Alzheimer's. In fact, 8 out of 10 people with type 2 diabetes are also overweight, a combination doctors now call diabesity. But here's what's new. For the first time in India, we now have access to 2 globally talked about drugs, Mounjaro and Wegovy. Launched just weeks apart, they've shown impressive weight loss results globally, and they're stirring up a lot of buzz. So the big questions are they the game changers we need? Who should take them? Are they safe? And what happens when you stop? We're joined today by Dr. Ambrish Mithal and Dr. Sonali Kagne. Welcome to the show.
Thank you.
Well, Dr. Sonali, let's kick off the show with you. If you could just give us the key differences between the 3 weight loss drugs that exist in India now. Wegovy, the injection by Novo Nordisk for weight loss, Rybelsus, which is the oral semaglutide by Novo Nordisk, and Mounjaro by Eli Lilly.
Okay. Wegovy and Rybelsus, the molecule is the same, which is semaglutide. The only difference is Wegovy is an injection which is to be taken once a week, and the oral tablet is to be, the Rybelsus, which is an oral tablet, it is to be taken once a day. If we compare the weight reduction efficacy of these 2 molecules, Wegovy is much better for weight reduction as compared to Rybelsus. Both these, the semaglutide molecule is, it belongs to the group of GLP-1 receptor agonist. Whereas now coming to Mounjaro, Mounjaro is a dual GLP-1 and GIP receptor agonist, and it is also an injection form which is to be taken once a week. The weight reduction efficacy of Mounjaro is currently the highest amongst all the molecules which are available. So it is to the extent of 22% average weight reduction compared to 17% with Wegovy and around 10% with Rybelsus.
Okay. All right. Dr. Mithal, how do these drugs work at this point? Because a lot of the feedback that we've got is that it sort of reduces the noise in your brain when it comes to cravings, when it comes to hunger pangs. Tell us, how do these drugs work?
So all these drugs work via the GLP-1 pathway. GLP-1 is a hormone that's secreted from the intestine and acts on the pancreas as well as the brain. Whenever we eat food, there is secretion of GLP-1. It acts, endogenous GLP-1 acts on the brain to control our appetite and satiety. It tells us when to stop eating. These drugs act through that pathway, and they act on the brain to tell us to stop eating and also to reduce our appetite. So the primary weight reducing action of Ozempic or Wegovy or Mounjaro is via their brain action. There are other actions also, like slowing the movement of food in the stomach, but those are all secondary. The primary action responsible for weight loss is the brain action.
Dr. Mithal, now give us a sense, if somebody walks into your clinic with diabetes and say is overweight as well at this point in time, give us what you are prescribing to them based on different BMI scenarios.
So for diabetes management in an overweight or obese persons, GLP-1 drugs are the first line of choice now, more and more. And as they become more easy to use and more accessible, they should be offered to most patients with diabetes who are overweight or obese.
Okay, so would
If you
that
want a
be an...
BMI cutoff, yes. So those above 30, even without diabetes, would be candidates for these drugs. Those who have a BMI over 27 and have diabetes, you were talking about diabetes. So those above BMI 27 with diabetes will definitely be candidates and should be offered these drugs.
Okay, so somebody who has a BMI between 25 and 29 and is not diabetic,
Correct.
would they be eligible for these drugs?
Ideally, we would like to look at the other causes, why they are gaining weight. We need to look into their lifestyle and try our best to, kind of make them lose weight with these other modifications rather than jumping on to these drugs. Because most of the times when they are in this weight category, some incidents would have happened recently or in this last 2-3 years or so, because of which they have started gaining weight. For example, in a woman, it can be a postpartum condition. For someone else, it is a sedentary job which has recently been changed. For someone whose job, the working hours are so long that they are not finding time for the exercise, or recently they have changed their eating habits or something. So there is some factor because of which they have probably gained the weight, or they were overweight to start with for quite some time, but they have never taken some effort to lose weight. And most of the times the awareness that this BMI of 25, generally we label them as healthy rather than overweight or obese.
Yeah.
So we have to change that mindset. Most of the time, if you look at average build wise, it looks like, okay, this person is normal. So we probably have to change that definition in mind. And this is probably the best time in the weight journey, where if you are aware that this is not my ideal weight and this is a little overweight, and if you just take care of small factors, you will definitely lose weight, and we need not jump for these medications per se.
Okay, so in that case, it's only lifestyle modifications. And what if that same patient comes back to you and says, I tried, I lost 10 kgs after 3 years, I put it back on, now what do I do?
So if in that category, they have already tried everything.
And they still don't have diabetes.
Fine. If they have already tried everything possible, still they are unable to lose weight, and they have some other comorbidities, not necessarily diabetes, but some hypertension, obstructive sleep apnea, or they have weight-related issues, then in that case we might consider for till the time they can probably continue their lifestyle and lead to a little weight loss, wherein they can just maintain the lost weight with the continued lifestyle modification.
Okay. Well, Dr. Mithal, what about somebody who walks into your clinic and has a BMI of over 40, is morbidly obese? What would you recommend to them?
So anyone who comes in with a BMI of more than 40, the first choice is always bariatric surgery. We've been saying this for years and years and years, but the problem is that most patients do not agree to go under the knife. So I think it's a huge task. And, such patients keep coming back. We keep discussing back and forth, lifestyle, a different diet. Now, at least if they disagree for surgery, we can help them. Maybe we won't bring them to target. It's very important to understand that if you lose 5 kilograms or 10 kilograms, you're helping yourself a lot. You need not always reach your target body weight. So if patient is unwilling for bariatric surgery, I would certainly put them on the GLP-1 drugs. In addition to this, there are patients who have agreed for bariatric surgery, but where the surgeon wants a little bit of weight loss to make the surgery easier or less difficult. And in those cases also, we are using these drugs quite liberally in preparing patients for bariatric surgery. So there is a role in those over 40 BMI, but there, of course, the first line treatment is bariatric surgery.
Okay, Dr. Sonali, what about you? Somebody comes in and says 110 kgs. What would you recommend to them?
So again, as I discussed, we need to start from the beginning, find out the causes, and depending upon the choice, basically, as Dr. Mithal has rightly mentioned, that many individuals, despite their BMI being even 44, 48, also sometimes they do not agree for the surgery most of the times. So in those cases, we might put them on this.
So do these drugs work effectively on them?
Yes. So basically the individual variation would be there, but these drugs which have shown this significant weight reduction in in other BMI ranges, they will also have the effect in this BMI range.